Do you currently take these medications and find they affect your blood sugar levels? Hi, my name's Diana and I'm your consultant pharmacist, diabetes educator and dietitian. So a lot of corticosteroid medications, or steroids as some people know them, include things like prednisolone, prednisolone, dexamethasone, hydrocortisone and many more. These medications can increase cortisols in your body, particularly for managing things like condition that includes inflammation. These may include rheumatoid arthritis, asthma, COPD, inflammatory skin disorders like eczema or psoriasis, and many, many more. Some people might be on these acutely for 5 to 7 days. Some people might be on them for a few weeks, and some people are on a low dose for a longer period of time. When you do take these medications, because they mimic how cortisol works, what can tend to happen, depending on how long the medication lasts in your body, is people find that blood sugar levels tend to rise. Now, most of the time, these medications are taken first thing in the morning, and people with diabetes do find that blood sugars rise up around 3 or 5 o'clock. So, how do you manage this blood sugar rise? One tip you could look into is after lunch movement. Any sort of gentle movement, whether it's a walk or anything within your capacity. Some of my patients actually do housework, and that can help reduce the afternoon blood sugar rise. Tip number 2 is looking at your diet. Because your blood sugar tends to rise before dinner and moves upward depending on person to person and which steroid you're taking, what you eat at lunchtime can make some sort of difference. By ensuring you have a balanced meal that's higher in protein, higher in fiber and vegetables, can tend to help mitigate the high blood sugar rises towards the afternoon. Now, in terms of carbohydrate for that meal, you want to watch the glycemic index, meaning that you don't want highly processed food, you want higher in fiber, and you do still want to control that portion. And last but not least, remember, if your blood sugars are rising and you need these medications to manage your condition, you can check in with your prescriber whether or not you need medication involved to manage those high blood sugar levels. Now, do you use any of these medications and find your blood sugars go up? Remember to try any of these tips or share any of these tips with anyone you know that use these medications.